Sir Guido, good evening.
Hi, good evening, Riza.
Professor, would like to thank you first and foremost for joining us. We'd like to also get your reaction on this record high cases, number of cases that we have logged today. Is this still within your forecast?
Yes, actually, I think we mentioned 1 or 2 weeks ago that we're going to exceed 25,000 cases, and we have, in fact, exceeded 25,000 cases. Though, to be fair, according to the Department of Health, 1,200 cases from today's tally were actually from yesterday. Yesterday, we had a relatively lower number, about 17,900. So that would have put it at around 19,000 cases yesterday. But even without that, those late reports, we would still be at about 24,695 cases today, a little lower than 26,000, but it would still have been a record. So, yes, it's still within the projections. It's a scary-looking number, and we're trying to unpack it, but we're seeing that the reproduction number is still around 1.36 in the country.
Professor, why are we still seeing record numbers over the year into the pandemic? And of course, with the vaccine being rolled out already, to which factor can you attribute this?
Yes, that's a good question, Riza. Why are we seeing high numbers even with a lot of vaccinations? Well, there will be some breakthrough infections for sure, although based on the data that we're seeing, a lot of the breakthrough infections will not progress to a severe or critical case, but will just remain at mild to moderate. And of course, we know that most of the cases are probably the Delta variant. So we're still trying to unpack the data, but yeah, it's the Delta variant, and even though we have a lot of vaccinations, a lot of people are still going to get the virus, and a lot of the unvaccinated people are getting the virus.
Sir Guido, the implementation of the granular lockdowns has been deferred. Do you think this would be of an impact to the numbers that we're seeing? And are we ready to shift, if ever, to another quarantine restriction?
Well, I haven't looked at or I haven't seen the details of the granular lockdowns that are going to be implemented. So, fortunately, we will have to see what happens after that is implemented. So we'll start seeing the effects of that sometime next week. We will have to hope for the best given the new quarantine restrictions, and we have to continue to work together. Everyone has to stay safe because the virus is still, very prevalent. It's very infectious, and we have to protect ourselves when we go out of our homes.
Certainly. Thank you very much for your time, and stay safe. That's Professor Guido David of OCTA Research.